Hello, my name is David Phillips. I'm Professor Emeritus of Chemistry at Imperial College London, and all my life I've worked on aspects of photochemistry. That's chemistry which is driven by light. But I've been particularly interested in the applications of photochemistry in medicine. And so I'm going to talk to you a little bit today about lasers and lasers in medicine. And we'll start with just a brief description of lasers. The word, of course, is an acronym. It means light amplification by stimulated emission of radiation. And lasers come in all shapes and sizes. In terms of the color of light you can get, you can have infrared lasers, which of course you can't see because they're in the infrared part of the spectrum. They can be very intense, and they can be continuous lasers or pulsed lasers. Over a whole range of different wavelengths, but all in the infrared. And they have use primarily as cutting devices in medicine. Then we have a whole range of visible lasers, which used to be ion-based, but now largely would be either dye lasers, again quite old-fashioned, or diode lasers, solid materials which give a whole range of colors. These are used usually in conjunction with a dye stuff which absorbs that laser light preferentially and leads to the destruction of tissue, and that process is called photodynamic therapy. And then we move into the ultraviolet part of the spectrum, where the energy carried per particle of light, per photon, is very high indeed, and this can cause, if the laser is intense enough photons per second, can cause the loss of the tissue because all of the chemical bonds break and the atoms and some small molecules fly off the surface, and so the tissue just disappears, and that's a process called ablation. And so when you want to remove tissue painlessly and without heat, ultraviolet lasers are the ones which are used, and that's used in corrective eye surgery. So the amount of energy that comes from a laser, of course, is measured in watts, as electrical energy would be. And what happens to the tissue depends on the energy density, how much energy per square centimeter. So below about 4 watts per square centimeter, which would be a low-powered laser, you can get what is called biostimulation, which means cells divide more quickly than they would in the absence of light. And that's useful for wound healing. Now, to give you an idea, this little handheld laser pointer that I have here, which if I can get it to work, has about 1 milliwatt. But the spot size is only about 2 millimeters by 2 millimeters. So if you amplify that up, that laser is about 25 milliwatts per square centimeter. But that's enough to result in biostimulation. It would be faster, of course, if you used a slightly higher powered laser. Above 4 watts per square centimeter threshold, you get what's called biosuppression. That is, the cells divide less quickly than they would normally, so wound healing, for example, would become slower. You slow the natural processes of the body down. About an order of magnitude greater than that, at 40 watts per square centimeter, you get, in the presence of a dye stuff which is specifically there in order to absorb the light, and would be called a sensitizer, you can get destruction of tissue surrounding the dye, and that's called photodynamic therapy. Around about 400 watts per square centimeter, now that is a very, very powerful laser, you get coagulation, which is just a medical term for cooking, if you like. You can denature proteins, and you can seal blood vessels. And at the very highest intensities which are used, around 4,000 watts per square centimeter, usually from a pulsed laser, you would get vaporization. The tissue just disappears, ablates, and so it's a kind of removal of tissue device. So one of the first uses of lasers in medicine was pioneered in Southampton by John Carruth. And it was the treatment of port wine stains, which you probably know are blood vessels just under the skin, which lead to really rather a disfiguring situation. As you can see in the slide, this lady has a port wine stain. It's a birth defect. Now, if you wanted to cure that by bleaching it using laser light, you would have to have the light absorbed by the coloured material, the blood, if you like. And it looks red because if you think of a spectrum, it's absorbing the blue-green part of the visible spectrum and leaving the red. So you want a blue or green laser to effect any changes. And so a blue-green laser of the sort I have here, which you can see, this is just a baby, of course, this is another laser pointer. This would be ideal for the purpose of trying to bleach this port wine stain. So after a relatively short period of treatment, you can see there's already been quite a dramatic effect. The stain has been bleached, and this is a permanent bleaching. And a couple of more treatments and her skin was relatively normal, and she was very relieved to have had this treatment. Painless and really quite effective. So that was one of the early uses. This is already 20 years ago that this was done. Now I'm going to show you some slides of an operation which is carried out where the laser is being used as a cutting device, and so it's an infrared laser. And here the operation is on a tongue. Now in this tongue, on the left hand side, you'll be able to see a large swelling. That's a tumour, a cancer which is developing, and if it's not removed, the patient will really have not much chance of survival. So if you were using a scalpel to carry out this operation, bleeding would be a problem. Your tongue bleeds quite readily, as you probably know. So using a finely focused infrared laser, you can cauterize the blood vessels as you cut, and you see that happening in this slide. A bloodless removal of a tumor, and painless also for the patient. What was removed, I think, is shown in the next slide, which is really quite a large tumor, about an inch in length and diameter. And the good news is shown on this next slide, where the same tongue, 6 months after the operation, you see a bit of scar tissue and regeneration of the tongue. And that patient was still alive 6 years after the operation, so was deemed to have been cured of the cancer. So that's cutting. Now, removal of tissue can be done either with infrared lasers of high intensity or ultraviolet lasers, which I mentioned earlier. And ultraviolet lasers are very often used to reshape the eyeball, the cornea, and so cure eye defects, so you don't have to wear contact lenses or spectacles anymore. And that's an ultraviolet laser which does not penetrate beyond the first micron or so of distance on the eyeball. So it's quite safe to use because it never gets into the eye and therefore can never do any damage to the retina, where visible light would certainly do that and would make you permanently blind. What we're going to show here is the use of an infrared laser to remove tissue which is causing harm. This is a patient, a smoker, who has a tumour which is developed at the branch of the trachea, which goes down from your mouth to your lungs, and the bronchi, which are the two passageways to the lungs. And you can see on this slide that on the right hand side the bronchus is completely blocked by the tumour growing at the junction, and on the left hand side there's a tiny little passageway that you can see where the patient can breathe, and for real on an endoscopic picture you can see just below the black hole, which is the only way this patient can breathe. Now, what was done was to use a powerful infrared laser just to burn away that tissue so that the bronchus becomes open, and you can see that on the real picture below on the right hand side, so the patient can now breathe normally. Unfortunately, it does not save the patient, because by the time you have the symptoms of this lung cancer or upper respiratory tract cancer, you probably will have secondary tumours, which are the ones which will finish you off. But it did allow a quality of life for the patient for his last few weeks of life.